Good morning, everyone. My name is Dr. Gabriela Kurushi, and I'm here today to talk to you about a topic that's really important to my heart, and the topic is addictions. Um, I lost family members, and I know many people who lost family and friends related to addiction. I worked in addiction about 12 years as my nursing career, and I met many patients and many wonderful colleagues and coworkers who witnessed that cycle and whose family has been involved in addiction. And it's really close to my heart. Addiction and mental health is extremely important. It's tied together. And after I finished my dissertation and I found myself kind of out of a job for a little bit, my family and children really encouraged me to finish that book, Mom, you started many, many years ago. Um, I started to interview people from all over the world, um, and colleagues, friends, family, social workers, doctors, nurses, people who have dealt with addiction, people who helped people with addiction, people who went through it, people who've seen family members go through it. And I collected their stories and wrote them down together with my story and my family's story in a book called Our Society, Addiction and More Uncovered. Hear the voice of everyday people, collection of stories and experiences. It is a story from everyone to everyone. You know, many times we can see statistics. They are really important. Scientific statistics are extremely important. That's how we learn what we need to focus on, where are the big gaps are. But the stories, they speak to our heart. Um, Even that many of these stories I listened to, I recorded, I listened to again, wrote them down, listened to again. Still, if I read these stories and talk about them, um, I can't help tears come to my eye. They touch my soul. And I think that's why it's so important to tell each other stories, because then the humanity, the person comes out of it, and it makes us want to do something about it and share it. And I believe it touch people more when we share our stories, kind of going back to our tribal being of being there for each other and helping and more understanding. Um, Addiction and mental health is still stigmatized. It's maybe changing a little bit, but um, mental health issues are there in the world. Every fourth person is affected by mental health, and that increased with the current pandemic even more. So today I would like to share the first chapter I wrote about addictions, the introduction to the book, and it was inspired by someone who I know who is a little hummingbird, one of my friends. And one day I had a hummingbird who was visiting me and in the garden, and it came to my mind that compare hummingbird and addiction, and this is how this chapter came about. So there we go. I'm going to read this chapter to you now. Hummingbird. Hummingbirds are amazingly beautiful and complex creatures. I have been really lucky that the last few weeks to see a hummingbird every day. It is summer and they like all the flowers around the house. When they come, I just stand very still and watch them, enjoy the beautiful company. One of the favorite foods for them seems to be the Chinese lantern. They just love that. The little birds are amazing. Their colors are beyond words. The fast way they flap their wings and fly is spectacular. They make very beautiful bird songs as well. People love them. They are astonishing little beings. Well, so far I have not met someone who did not like hummingbirds. They are very beautiful and delicate creatures, and they have to fight to survive every day. It is truly amazing what their little bodies can endure. They have a very fast beating heart, extreme wing fluttering, and they have to drink nectar very frequently or they would starve to death. Many die during their first year. They are also able to control their temperature and heart rate, which go down very, very low and slow at night and beat very fast during the day. It is a unique moment when someone can see them sitting on the branch. Hummingbirds are also fight for their food and chase each other away. I'm sorry. I'm sorry, it's hard for me to read this because it makes me remind me of all the people who we lost because of a low heartbeat. Hummingbirds and people dealing with drug and alcohol addiction have a lot in common. I believe that all people are very beautiful, no matter what disease process or habit-forming issue they have to deal with. Addiction is a very complex phenomenon. When someone is dealing with addiction, they have a strong urge and craving to get their next dose. Deep into addiction, people many times fall into a trap, and all they know is how to live their addicted life. People had told me that they kept using drugs because of fear of what will happen to them if they don't. The fear included that they will die if they do not get their next dose or they get very sick. Many people die of addiction within their first year of use. Drugs and alcohol can increase and decrease a person's heart rate to a point many times that the heart cannot take it anymore and can result in fibrillation or heart attack. The heart can also slow down too much and can cause death. Getting to food for the hummingbird for the next fix for someone with addiction is the same process, a need to be filled. In both cases, there is the knowledge that if this desire is not filled, the person will become sick and start to withdraw. Withdrawal from substances can be very dangerous and could cause death. There's no choice in the matter. Life or death is at stake. There's one major difference between a hummingbird and a person who is dealing with addiction. It is hard to see beyond the addiction and find the beauty in a human being. People won't judge a hummingbird, while people would judge someone who is dealing with addiction. Nobody wants to be addicted to anything, especially if it causes detriment to self and others. There are many addictions that people can get caught up in. This could include, but not limited to, smoking, vaping, using any device for smoking or any harmful substance, food, gambling, sex, social media, gaming are some examples. People get caught up in the web that is really, really hard to unweave. My goal with this book is to change some judgmental perceptions, to uncover some false perceptions about addiction. We'll share many experiences and ideas with many others who I had interviewed, including professionals from the addiction world, counselors, people from the medical world, nurse practitioners, nurses, nutritionists, police, prosecutors, mothers of addicts, youth, priests, families, Friends who know people with addiction as well as individuals who are currently addicted or have been addicted to many substances. This is the first chapter. The next chapter is about my uncle. The book is dedicated to him and to all the people who lost because of addiction. As I said, no matter how many times I read some of the stories in the beginning, I remember the people who we lost, and it's hard not to have tears in my eyes. Hope you forgive me. Um, Addiction is a really horrible disease, and if there's anything you can do to help a person who is out there who is dealing with addiction, support them into getting treatment. Just be there. Not enable, but just be there for them. I'll thank you for that. Thank you so much for listening for my first chapter today. Until I see you next time. Take care and be safe out there. Much love, Gabriella.